My child's injured, and with all the coronavirus problems right now, I'm not sure where I can get help.
Hi, I'm Dr Kate Edgworth. I'm an emergency consultant from Birmingham Children's Hospital. Despite COVID, we are still treating injuries and we are here to help. In this short video, I'll talk about broken bones, cuts and burns.
My son fell off the monkey bars in the park and he can't move his right elbow. It looks really swollen.
If your child injures a limb and it's swollen, painful, and they are unable to move it, they could have a fracture. Give your child some paracetamol and bring them to the emergency department. Any break that causes a bone to poke through the skin or causes the limb to go numb needs to come to the hospital urgently.
My daughter fell on her knee while she was running and it's got a nasty graze causing her quite a bit of pain. What should I do?
As long as she can bend and straighten her knee or arm, finger or thumb, all you need to do is give your daughter some pain relief like paracetamol and give the knee a gentle clean with lukewarm water. The graze should heal in no time. Just make sure your child's tetanus shots are up to date.
My son fell and banged his head against the edge of the coffee table. He's now got a gash to the forehead and it's bleeding loads.
If your child gets a deep cut, find some clean cloth and apply gentle pressure to stop the bleeding. If you have a clean dressing at home, put this on the cut before you come to the hospital. If it's a deep cut, it's important that your child comes to hospital within 12 hours to have it repaired. Longer than this and there's a risk of infection and we won't be able to close it. Most small cuts can be fixed with medical glue, so it should cause no distress to your child. Also, if your child's over 12 months and they've bumped their head, as long as they didn't lose consciousness, they didn't have a seizure, and they haven't vomited, and you're happy that they're back to their normal self, you can watch them at home. But bring them in if they're abnormally sleepy, they start vomiting, or they're an infant with a big bruise.
I feel terrible. I left a cup of fresh coffee on the table. My daughter's pulled it onto herself. She's crying in agony and the skin on her chest is starting to blister. What do I do?
This is very distressing, but even though your child's upset, it's important that you give your child the first aid for their burn. Expose your child's burnt area and treat with cool running water. A shower head is ideal for this. You should try and treat for 15 to 20 minutes. After you've done this, cover the burn in cling film if you have it. Things like toothpaste don't help. And give some paracetamol for pain relief. You'll then need to bring your child to the emergency department where we can treat the burn. Burns we need to see are those that have blistered or look pale and white. Small burns less than the palm of your child's hand, which are only red and quickly turn red again after you gently press the area, like mild sunburn, can be treated at home with cooling and paracetamol. But if the burn blisters, bring your child to the emergency department. If you're concerned about your child and you're not sure how to treat them, contact NHS 111.